Good afternoon, everybody. 12:30 the time on a very, very pleasant. We should take this outside. It's so nice outside. Kenna, what do you think?
Really? It's pretty nice.
It is a peach outside, like 53 degrees right now in January. It's good. But it's nice and warm in here, too, because, you know, if we get sick or anything, we've got help here today.
Well, you've got a group in there, don't you?
Got a slew. Remember the slew. We talked about this in our staff meeting today. A slew of things here. We got Dr. Jennings and a couple of representatives from Liberty College here. And this should be very interesting. Good afternoon, everybody. How you doing?
Doing
good.
well.
Perfect.
Very good. So this is a pretty cool town. Pretty cool place that you guys are in town here and going, you know, furthering your school and working with St. Anthony's Hospital, which is awesome stuff. First, let's introduce everybody. We got Dr. Jennings, of course. Are you doing all right today?
I'm living the dream, sir.
All
living the dream.
right.
How about you two guys? Who are you? Where are you guys from?
So my name is Sahil Vaga. I'm actually originally from San Diego, California.
San Diego,
Well,
nice
that's
place.
a nice place.
It is. It
Yeah,
is.
I'll trade you places. I'll go there. You can live here, okay? How about your name?
I'm Tom Rutherford. I'm actually just from up the road in Decatur.
Mm-hmm. And I think I had
Related
your
to
mom here
Teresa.
today.
May have heard that name a few times.
Yeah, she's a mighty fine lady, no doubt about it. So, this is good to have you guys here. It really is neat, and we're going to find out a little bit what you do at St. Anthony, what all you're learning, and why you're doing it, of course. Dr. Jennings, how did these medical students come here to Effingham?
You know, it's really a great story for both of our sides, as far as both the Liberty University College of Osteopathic Medicine as well as HSHS St. Anthony's, because, you know, one of the long-term efforts that the hospital works so closely on is trying to develop opportunities for us to continue to bring new providers to the region and make sure that we are here for another 140 years to continue to deliver health care. And, you know, sometimes it's a struggle to recruit new physicians to the region. And the best way to get somebody to come take a look at Effingham is when they're familiar with it to begin with. And so, you know, we started having a lot of conversations about how do you get folks to come take a look. And by the grace of the fact that Tom actually is in the inaugural class out at Liberty in Lynchburg, the acquaintance with Teresa then happened, so that you know, when you think about the alignment of our mission, which of course is to deliver health care to those who need it, it aligns perfectly with Liberty's mission. And they were looking for an opportunity to place students in various smaller communities, and the opportunity just fell in our lap to some extent, and has been fantastic. So we've been able to bring in the part of the inaugural class from their perspective. So we got 10 students, 2 of them here today, and start their third-year rotations with us.
So what does a typical day kind of consist of for them?
You want to go
Or
ahead?
is it word typical even
Typical,
usable?
yeah. Probably every day it's a different kind of typical, I guess.
You're kind of right. Yeah. So we rotate between doctors every month or so.
Mm-hmm.
So the typical kind of what you can expect in a day really depends on who you're with, whether that be a surgeon or an internist or whatnot, and how busy they are. So as of right now, I'd say I usually get to the hospital at maybe 7:20, and then stay in surgery until maybe 2 o'clock, 3 o'clock,
Okay.
and then go to the office and see some patients.
Very good. Real quick, what do you guys want to be whenever you get done with school? You know, you want to be a doctor, of course, but what part
Sure.
do you want to do? I was curious.
As of now, I want to be a hospitalist.
Okay.
I'm an internal medicine physician.
How about you?
Emergency medicine is what I know. I was a nurse
Okay.
in the emergency room in Decatur before that, and still have kind of that ADD towards emergency medicine. So about 3 weeks is my limit, I think, for focus.
Okay, I
Which
got
works
you.
out well for a 4-week rotation. But emergency room gives me the opportunity to see all types through specialties, and also get a little bit of primary care type environment as well.
Sure.
So month to month, just they're with a different specialty each month.
Okay.
I like
So
that.
they spend 4 weeks with one preceptor for a 4-week rotation, and that's everything from internal medicine to pediatrics to obstetrics. Of course, we talked about the surgery piece, psychiatry. They actually go out of town for us for psychiatry, but otherwise they get to spend all the rotations here in Effingham and one-on-one time with the physician, which is fantastic.
I like the idea, because who knows, you're planning on doing this, you're planning on doing that. You may find something that you like even better on something like this, isn't it?
Exactly, and that's what it's designed for.
Yeah.
For something to maybe grab you and
point you in the right direction.
Yes, sir.
So it's
Yes,
pretty
sir.
cool. All the doctors are on board too with this. That you.
Yeah, I can't say enough about our physicians. When we first started these conversations, having not had an academic, environment here previously, the docs were kind of, well, are you sure we want to do this? And just
that's a whole new ball game for around
it's
here.
a completely new ball game. And once we got them on board, they've done a fantastic job, and it's really changed the environment in the hospital to raise the bar as far as the conversations in the hallway around patient care and the latest and greatest. These guys make us go back to the not to the textbook anymore. Now we got to go to the internet.
That's right.
Try to stay on top of them so that we can look like we're smarter than the young whippersnappers.
Oh,
But,
yeah. Don't let them get past you, that's for sure. Was there other places you could have gone besides St. Anthony? I was curious about that.
Yes. So roughly half of our class stayed in Lynchburg, Virginia.
Okay.
There's also Roanoke area and I think outside of Richmond.
Halifax, Virginia
Okay.
was another one. Danville, Virginia.
Also a small little group in Texas as well. But I think after the conversations, I didn't really have there wasn't much of a
Well,
choice.
much of choice for you, right? Mama said you're coming
You're
with me.
coming home for a
There
while.
was a lottery where we actually picked every classmate kind of got to rank order where they would like to go,
Sure.
and then based on the available positions and what the hospitals could handle, then they kind of gave you your first, second, or third choice from
Okay.
there.
Now, you're from San Diego, so a little
I
different. How come you chose St. Anthony?
I think the main reason that I chose St. Anthony's was just kind of the small tight knit group of students that was going to be here. As a third year medical student in rotations, it's not common that you get to have one-on-one time with the doctor.
Oh, I imagine not.
Every day, let alone stuff like that. So here, I get that for every one of my rotations. I've been one-on-one with the doctor.
That is so cool.
That is amazing.
I don't really have to compete with anyone. I
Oh, that's
suppose.
good. Yeah, so you're always front and center with the doctor you're with that time. That's
Sure.
great. That's amazing. Well, how's it? How has been your experience here?
Any
Interesting.
social life?
Yeah, from San Diego, though, it's probably a little different, huh?
It's different. It's different. I've enjoyed it. I've been here 7 months now, and it's really turning out to be a pretty good experience for me. The community is really welcoming, and there's some stuff to do here. Most of the time, I kind of just stick to my daily routine.
You're
but
pretty busy anyway,
Yeah,
going through this.
try to keep busy.
Gotta have a little fun once in a while, though, right?
Yep.
Doctor
Done a
Dr.
good
Jennings
job getting
taking me out.
yourself. Well, say I get him out of it. He's joined the YB Next with the
Okay.
chamber.
Oh, okay.
And, really tried to be as active in the community as he can be. And
Sure.
it's amazing to me. I'll be out and about with a student somewhere, and they get recognized in the community, going, "Hey, you're my doctor." And,
Oh, that's nice.
yeah, it's great, and a real compliment to both the students and the preceptors for being so open with the community.
It's very cool. So it's been a good experience for you so far, both of you, right?
Absolutely.
sure.
That's awesome to
Yeah.
hear. Very awesome to hear. What have you learned? Quickly. I can't ask you everything you learned.
Yeah.
Maybe a few things you've learned that maybe you were surprised to learn here in a smaller area.
Yeah. Do you want to go first?
Ooh, it's a
It's a tough one.
yeah. To narrow it down,
Don't let out any protected health information.
Yeah.
Yeah, don't go there.
No.
Well, I had this one woman. No, you don't go there.
No.
I think just how to interact with the patients in a smaller community. I mean, it's people bring in their mothers and their husbands and kids, and you see such a wide variety, and you see them out at the different eating establishments at the grocery stores, and then just so that personal connection on how to make that with a patient and their family has been like a big thing versus the
I
idea
see
of being
that.
at a larger institution where
If you were at St. Louis,
I would be a number.
Exactly.
You'd hardly
Right.
ever run into somebody unless you're just lucky.
the doc's behind a computer screen or in for 5 seconds here. Physicians are sitting down. They're talking with their patients. They're holding hands. I mean, they're there for the best times and the worst times in some of these families' lives, and just being able to be a part of that and kind of take away from it is huge for us.
I couldn't believe even, when my parents were ill at the time, how many of the local doctors would actually call me at home and give me updates. You don't get that in a big
No.
city.
Yeah.
Not at all.
Would you guys think about staying?
What's
I'm
that?
going to put you on the. Would you think about staying in Effingham?
I would think about staying. I haven't made my decision yet.
Sure.
But I would think about staying.
How about you? Even
Oh
with
yeah,
Marlboro?
I mean, this area has been great. Not having what was crazy, not knowing the gem of Effingham, even just being an hour, growing up and living in Decatur for so
Sure.
long, and then coming down here and. My mother's done nothing but rave about the community since
She
she
loves
got
the
here.
town, doesn't she? She really does.
And how open and welcoming they were to her and us as students has been just great. So
Awesome to hear. Awesome to hear. Well, thank you guys for coming in and
You're
doing
welcome.
this. Dr. Jennings, how's it been for you on the doctor's side?
It's absolutely been a pleasure. These guys, as we talked about the idea of being in a smaller community, I think that's where they've had incredible learning opportunities around, seeing that individual interaction that Tommy spoke to. But at the same time, we've had, cool cases that you couldn't possibly have been in the front row. If you were in a bigger center, and they got front row seating. Our docs have done a fantastic job of working together to make sure that they do get to see those most fascinating cases when those walk through our door. So it's been great, and I've been amazed at the impact on my physicians with regards to even kind of burnout. You kind of get into your day to day, and you're doing your thing, and suddenly the students come in, and you go, well, yeah, this is the enthusiasm I had around this, 20 years ago, and kind of reinvigorates, reinvigorates the docs as well. So, and again, to reiterate, the community support's been just fantastic.
Patients have all been welcoming when
Absolutely.
Great.
Oh, I'm sure.
Absolutely. This is a great idea. Now, unfortunately, we can't just tie them down. They've got to go away to residency for a few years.
That's true.
But really the goal is that now when they get that phone call from us and say, hey, what do you think about coming back to Effingham? It's not just a cold call. They go,
Sure.
oh, man, I loved Effingham.
enjoyed my time
I can't
here,
wait
yeah.
to go back.
Good.
Exactly. So, long term, a great pipeline for us.
this is wonderful.
Yeah.
And looking forward to next year's class.
Yeah, got another class. Going to expand even a little bit?
Correct. Yeah, we actually, Teresa and I were just out in Lynchburg right at the first of the year and got to meet the current second-year students that will be looking for third-year rotations this fall and anticipate having 10 additional students. And then most of these guys will still be rotating here as well as kind of going to some outreaches as they prepare themselves for residency slots.
Oh, yeah.
So it's a continuous cycle and continuous learning, which is wonderful.
Well, sounds like a great thing for everybody involved.
Great program.
No doubt
for sure.
about it. Hey, guys, all of you keep doing what you're doing. Keep up the good work,
Well, thank
and we
you.
appreciate you coming in today, okay?
You're very welcome.
Thanks for having us.
All right, very
Appreciate
good.
the
A great program here at Effingham St.
Absolutely.
Anthony Memorial Hospital. Thank you much, guys. All right, there you go, Ken. That's pretty cool. Makes you feel like if I'm sick,
Absolutely,
I think I'll get taken care of. I don't feel very. I got this thing on my chest right now. Can you guys bring your tools in with you?
Uh-oh, they're tools.
That's
this
right.
is-
Yeah.
We're getting a drill for you.
I could use one, no doubt. Kenny, you have a good one,
You
all right?
too.
When you try your best but you don't succeed.